Breast cancer is one of the most common types of cancer found in women, with more than 1 in every 10 cases of new cancer diagnoses. Shocking! I know, this means 1 out of every 8 women in the United States has been diagnosed with invasive breast cancer. That's about 10% of the total population. But how do we detect breast cancer in its early stages, and how do we even conduct a self-exam? What about risk factors for this deadly disease? Don't start worrying yet. Stick around and we'll address all your concerns in today's video. Let's start by giving ourselves a preliminary self-examination. Breast cancer may not show clear-cut signs in its early stages. It gradually develops over time without dropping hints, so it's crucial to identify this silent killer as soon as possible. The question is, how? Well, the easiest way to go about it is to do a self-examination. A woman knows her body best, so you may notice an abnormality or changes through a physical examination of yourself. Based on this, there are 2 ways to conduct a breast self-exam. A visual exam. Number 1, stand facing the mirror shirtless with your hands at your sides. Number 2, look closely at your breasts and watch out for any unusual wrinkling and changing in size, shape, and symmetry. Number 3, place your hands on your hips and see if you notice any abnormalities. You can also use your hands while inspecting your breasts. Use the pads of your 3 middle fingers instead of tips to examine your breasts. Your finger pads will be more sensitive to feeling and detecting abnormal growth or lumps. If you have difficulty feeling, you can use another sensitive area like the back of your fingers or palm whenever you deem fit. Next, apply pressure slowly to analyze the depths of your breast. Then increase the pressure to feel more of the breast contents, but be firm when feeling the extreme depths of the tissue close to your ribs. Remember to take your time with it. Be careful that you don't hurt yourself. Because you don't want to miss out on any areas, we suggest following a definite pattern. You can start with your collarbone and move toward the nipple, then go towards the outer edge and address the next section. To simplify the process, you can perform the self-exam while lying down. This will spread your breast tissue, making it thinner and easier to access. Now, at what point should you see a doctor? Sometimes lumps can be false alarms. Your breasts undergo a lot of changes with age and alternating menstrual cycles, and they're not as uniform as some of us might consider them to be. They're unique in their ways. But still, we should differentiate these complexities and address what is normal versus abnormal. If you notice any of the following signs, you should seek medical advice. Number 1, a hard lump or knot under your arm. Number 2, dimples, puckers, ridges, or bulges on the skin of your breasts. Number 3, a prominent thickness of the breast tissue as opposed to the surrounding tissue. Number 4, redness or swelling, if any. Number 5, unwarranted pain or warm sensations. Number 6, itching, rashes, and sores. Number 7, bloody nipple discharge. Number 8, any recent inversions of the nipple where it seems to be pushed inside instead of sticking out. After a physical examination, your doctor may advise you to go through a set of diagnostic tests, like a mammogram. In the case of a suspected tumor, you'll be asked to undertake an imaging test known as a mammogram, which will provide you with a better understanding of what is underneath your breast tissue. Most women over 40 should get checked using mammograms annually to rule out the possibility of breast cancer. An ultrasound may also be issued. This test uses sound waves to detect an underlying cyst or tumor by creating a visual picture of the depths of your breast tissue. If mammograms and ultrasounds show positive signs of breast cancer, you might be asked to undergo a breast biopsy. A breast biopsy will involve taking a tissue sample from the suspected spot and sending it to the laboratory for a detailed analysis. What are the risk factors involved? A disease will always have a set of risk factors that can push you one step closer to it. And yes, although there are a few aspects you cannot control, taking preventative and precautionary measures can help you avoid that dreadful diagnosis. Let's start with the unmodifiable risk factors that you have no control over. Your sex and age. Females are more prone to developing breast cancer, and this has something to do with the design of their bodies. The reason behind this bias is enhanced hormone stimulation. The altering balance of estrogen and progesterone hormones in a female body is due to various developmental stages of her life, like adolescence, menstrual cycles, pregnancy, and menopause. Unlike men who have insignificant estrogen levels in their bodies, it is very uncommon that a man will develop breast cancer, as less than 1% of breast cancer cases occur in men. Breast cancer is also a health issue with a higher case of developing as you age, and aging is inevitable. There's an increased risk of breast cancer of about 1.5% as you reach your 40s, and 3% as you reach your 50s, and more than 4% by the time you reach your 70s. And get this, 80% of those with breast cancer are over 50 years of age. Not to mention genetics and race can play a crucial role. Did you know that if one of your parents, siblings, or close aunts had breast cancer at some point in their lives, then chances are that you could be one of the unfortunate heirs to this deadly disease? Almost 20% of individuals with breast cancer report having a first-degree relative with the same condition. And not just this, your risk is even higher if your first-degree relative developed this disease before turning 50. Also, a family history of ovarian cancer increases your risk of developing breast cancer due to BRCA1 and BRCA2 gene mutations. These, like all other genes, are inherited from your parents. They protect you against certain cancers, but some mutations or changes in the DNA sequence prevent them from working correctly. This might open a window for cancer to creep in. So if you inherit these faulty genes, you are likely to develop breast or ovarian cancer. But since you have two copies of these genes, one from your mother and the other from your father, it does not necessarily mean that you will get cancer even if you have one faulty copy. You will only develop cancer if your second copy mutates over time, and you end up with two damaged genes. When it comes to race, there are wide disparities in breast cancer prevalence regarding ethnicity. White, non-Hispanic women have the highest incidence of breast cancer, while mortality rates are the highest among Black women. Although the main reason behind these variations are unclear, some theories suggest that it has to do more with socioeconomic backgrounds and access to healthcare systems. After all, those with better healthcare facilities will have higher chances of survival. A few studies have also highlighted biological properties in different ethnic groups as the cause of breast cancer prevalence disparities. These include differences in cell cycles, plasma levels of growth hormones, reproductive factors, and tumor characteristics. These variations in white and Black women can potentially influence their early detection and treatment outcomes. And surprisingly, your reproductive history also has a lot to say in the development of breast cancer. Who knew that conceiving in your early 20s could have add-on benefits to your life? Well, pregnancy could provide a protective shield against any carcinogenic occurrences. However, studies have shown that these positive effects were more prominent after 34 weeks of pregnancy. Researchers also saw that women with a history of hypertension during pregnancy, or preeclampsia, or children born to a preeclamptic pregnancy had a lower risk of developing breast cancer. Early self-examination is crucial because having dense breast tissue can add to your risks. The density of your breast tissue changes during different periods of your lifetime. Females of a younger age or those with lower body mass index are observed to have a greater density of breast tissue, exposing them to a higher risk of developing breast cancer. And it also poses diagnosis difficulties when undergoing a mammogram. Studies have also shown that premenopausal and postmenopausal females are at an increased risk of this disease. Unfortunately, breast cancer often revisits. If an individual has a history of breast cancer or benign breast disease, there is a higher chance the cancerous lesions can renew within her breasts. And if you've gone through radiation therapy before, the lingering effects can cause secondary malignancies. Although it varies from person to person, studies have shown that patients who undergo radiation therapy to treat cancer and fall under 30 years of age are at a greater risk of developing breast cancer. Yes, it seems hypocritical. How treatment can cause the same disease, but that's the harsh reality. Now let's discuss modifiable risk factors that may give some control over breast cancer development simply by making positive amendments to your lifestyle. Breast cancer can be a side effect of drugs. Intake of diethylstilbestrol during pregnancy can induce breast cancer in children. It's a synthetic form of estrogen, usually administered to prevent miscarriage, premature labor, and other pregnancy complications. Women who use hormone replacement therapy for more than 5 to 7 years are at a greater risk of developing breast cancer. Several studies have highlighted the use of antidepressants, prolonged consumption of antibiotics, hypertensive medications, and non-steroidal anti-inflammatory drugs as detrimental to your health, which might lead to cancer incidence in the long run. Next is being physically inactive. If you're a couch potato and hardly ever indulge in workouts, gaining weight is an obvious repercussion. But no matter how common and regular weight gain and obesity may sound, they are the reason behind most health problems. One of which is cancer. Women with an elevated body mass index in their 50s are more likely to develop breast cancer. And if you're an alcoholic, you're in danger. If you drink excessively, it's time to reduce your alcohol consumption to minimal levels, as this might be taking a heavy toll on your health. Studies have often associated excess alcohol consumption with carcinogenic events characterized by abnormal cell division and tumor formations. So this is your cue to act and be wary of what effect your unhealthy drinking habits may have on your body. And this includes smoking. Whether you're an active or social smoker, as long as you're suffocating your body with tobacco intake, you're causing many health issues. Studies have shown that smoking can lead to specific gene mutations due to carcinogenic compounds and can be a significant contributor to the incidence of breast cancer. Dealing with breast cancer can be traumatic for one's physical and mental health. It's equally bad for your loved ones, too. There's a growing need to raise awareness about breast cancer and its screening. So share this video with all your friends and family to help them get to know breast cancer a little better. Are you interested in learning more about cancer? Watch 11 early cancer warning signs that you shouldn't ignore, or 9 superfoods that help prevent and kill cancer. Go ahead, click one, or better yet, watch both. Share your concerns about breast cancer. Have you noticed any relatable signs lately? Let us know in the comments below.